If you're considering using therapeutic nutritional ketosis or a ketogenic diet to treat serious mental illness, you want to do it with your physician and your healthcare providers and not by yourself. And in this video, we're going to help show you some of the main concerns physicians may have and give you some tips for communicating with your physician about this important topic. But first, welcome back to Metabolic Mind, where we're working to revolutionize the treatment of mental illness by providing information and resources at the intersection of metabolic health and mental health. I'm Dr. Bret Scher. Metabolic Mind is a nonprofit started by Roblox founder David Baszucki and his wife Jan after their son Matt sent his psychiatric symptoms into remission with a metabolic intervention, nutritional ketosis. Our goal is to help families like theirs learn about this new approach to treating mental disorders and to offer a message of hope. Freedom from the burden of mental illness is possible. In our prior video, we reviewed ways you can consider communicating with your doctor about starting therapeutic ketosis, and we covered the top 3 concerns physicians may have about you starting a keto diet, including if it increases your cardiovascular risk. In this video, we'll cover the next top 5 concerns clinicians may have, including those who feel there isn't enough evidence to support therapeutic ketosis for treating mental illness, and that it's too restrictive or that it's harmful to avoid so-called healthy whole grains, and others. But first, a reminder, our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have dramatic or potentially dangerous effects if done without proper supervision. Consult your healthcare provider before changing your lifestyle or medications. Therapeutic nutritional ketosis, or simply starting a keto diet, is a powerful health and medical intervention that can change your body's metabolism and can dramatically alter brain function, medication levels, sleep patterns, energy levels, and other physiologic functions. You should not start a keto diet alone if you have a psychiatric diagnosis or symptoms or take psychiatric medications. So now let's get into the remaining concerns from clinicians. So the 4th concern is that a ketogenic diet is too difficult to follow. It's too restrictive. It's unsustainable. This statement is very subjective and clearly in the eye of the beholder. The internet is full of people who have been on ketogenic diets for a decade or more, and I've met so many of them personally. So it's clear it's not restrictive or difficult for some people. But what's interesting is many clinicians who use therapeutic nutritional ketosis find that the more someone benefits from it, the more likely they'll maintain it. So if someone has fairly severe symptoms of mental illness and can improve their symptoms and quality of life dramatically, then clinicians find those patients are much more likely to stick with the diet long term. Also, it doesn't have to be restrictive, right? Just because it eliminates junk food and ultra-processed foods and grains and sugars, there's still plenty of sites with thousands of recipes using foods that fit within a ketogenic diet to maintain variety and enjoyment. So is a ketogenic diet too restrictive? Well, that's in the eye of the beholder. I don't think so, and there are many others who don't. Using meat, eggs, seafood, fish, dairy, nuts, all the above ground vegetables you want, some fruits. You can make so many complex, interesting, intriguing recipes. It does not have to be restrictive. Now, the next concern, which is the 5th on our list, is that your body needs carbohydrates. And this is just absolutely false. But unfortunately, many dietitians are still trained that the body needs 130 grams of carbohydrates per day, which again is simply not true. Now, it's true to say the body needs glucose because some parts of the body, such as red blood cells, or even probably about 30% of the brain, need glucose to function and can't function on other sources of energy like ketones. But that doesn't mean you need to eat carbohydrates to get that glucose. And that's where there's the misunderstanding. So because your body can create its own glucose in the liver, a process called gluconeogenesis. And this automatically happens when you don't eat carbohydrates. You don't have to think about it. You don't have to try and do it. The body just does it. So it's true to say your body needs glucose, but it's absolutely false to say that you need to eat carbohydrates to get that glucose. Now, the 6th concern is about avoiding fiber and whole grains. So the first thing to recognize is that a keto diet does not have to be a low-fiber diet. Above ground vegetables and nuts, they're full of fiber, and they fit very well within a ketogenic diet. So there's absolutely no need that a ketogenic diet has to be a low-fiber diet. That's just simply not true. But now, what about the concern about these so-called healthy whole grains? Well, that's also, unfortunately, a bit of a nutritional misconception. So the science seems pretty clear that when you're comparing diets with whole grains to diets with refined grains, well, it's not much of a surprise, right? The whole grain diets look much better from a health standpoint. But there's actually no comparison, no studies comparing the benefit of whole grains versus no grains, right? And we'll link to a reference in the description that has more information on whole grains. But it's correct to say that switching from refined grains to whole grains will likely provide better health benefits on average. But it's not clear that a healthy grain-free diet is worse than one that does contain whole grains. This simply hasn't been studied yet. So that's an area of nutrition that you just have to look a little bit deeper and think a little bit harder about to realize that connection hasn't been made. Now, it's much easier just to say everybody should eat the whole grains, right? That's an easier message. And it's taken me much longer to explain why that message isn't true. But that's where I think it's more important to understand the details. Next, number 7 on our list is many clinicians will be concerned that meat is bad for your health, so you should just plain old avoid it. Now, the first concept, again, similar to like the low fiber diet, a keto diet doesn't have to be a high meat diet. It sometimes is, but by no means does it have to be, right? Fish, eggs, avocado, nuts, seeds, they can provide all you need on a ketogenic diet. But also, perhaps more importantly, the evidence suggesting red meat harms your health is actually pretty poor quality evidence when we look at it. It's based on low quality observational studies which suffer from poor data collection, healthy user bias, and very small hazard ratio or effect ratios. As an example, observational studies demonstrate that people who eat more meat also tend to eat more calories and smoke more and drink more and exercise less and so on. Basically, they're simply less healthy overall. Because if you think about it, when these studies are being done, the overlying paradigm is that meat is unhealthy. So who are the people in these studies who are likely eating meat? Are likely the people who are less healthy. So when that's the case, how can you say it's the meat's fault, so to speak, that they're having more health problems? You really can. It takes sort of statistical gymnastics to try and prove that. But here's another way to look at it when we talk about sort of the hazard ratio. So let's look at smoking, which is associated with an increased risk of lung cancer and a hazard ratio between 15 and 30, depending on the study. Now, that's the statistical estimate of how much more likely you are to get cancer if you smoke. For red meat and cancer or red meat and heart disease, the hazard ratio tends to be around 1.18 to 1.25. Not 18 to 25, but 1.25, which is minuscule as far as statistics go. I mean, compare that to the 15 to 30 for smoking, and now we're talking about 1.20. I mean, that's just minuscule. So in conclusion, the potential adverse effects of meat are pretty much overstated. If the statistical signal is so weak in a large population study with poor data collection and many confounding variables, how can we possibly pretend to know what impact eating meat could have on you as an individual? It's one of those cases where it may be statistically significant, but it isn't likely clinically significant. And that's not a very popular belief right now, but if you look at the science, I find it hard to interpret it otherwise. Now, the 8th and possibly most important concern from physicians could be that there's no evidence demonstrating that ketogenic diets conclusively improve mental health symptoms. And this is partly true. There are no large-scale randomized controlled trials showing that a keto diet improved mental health symptoms, at least not yet. Those studies simply haven't been done, although thanks in part to funding from the Bazooki Brain Research Fund, there are 5 pilot trials underway with more to follow. So how can we think about this perceived lack of evidence? Well, I want to go back to Dr. Georgia Ede to hear her take on this and how to potentially respond to doctors.
For people for whom the line is long-term randomized controlled trials, we may be waiting a while, but they're coming. They're coming. We've got some wonderful research in the pipeline, thanks in no small part to generous funding by the Bazooki Foundation, by the way. But I think that what I like to say to people when they ask me, why would you want to use an intervention like this when there's so little clinical trial evidence to support its use? And I often will say to them, well, why wouldn't I want to use this intervention when you compare it to all of the other interventions available? There are many, many advantages that this one has over the others. But from a scientific standpoint, what I like to say is we have over 100 years of clinical and research evidence supporting the safety and efficacy of ketogenic diets in epilepsy. And I like to point out that epilepsy is a neurological condition that affects the brain, whereas psychiatric conditions are neurological conditions that affect the brain. The brain isn't divided into neurology cells and psychiatry cells. It is one organ, and therefore it stands to reason that a dietary intervention that stabilizes brain chemistry in the case of epilepsy could also stabilize brain chemistry in the case of, say, bipolar disorder. So bipolar disorder and epilepsy, we know, share many common underlying features. We even use a lot of the same medications to treat the two conditions. So I think that when people say that there's not enough science, I actually can't think of another intervention where there is this much science available for us to draw upon.
Wow, what a statement, right? I can't think of another intervention where there is this much science to draw upon. That's pretty powerful, and that really sort of flips it on its head. You just have to look at the science from a different perspective, but it's there. So once again, let's hear from Dr. Ignacio Cuaranta on the hope and importance of being open to this type of therapy.
Like the first line of contact with the patient. Sometimes they are very anxious, they are feeling depressed, and they want to know if something is going wrong. And what I found is that when they get empowered in regards to the food choices, their sleeping patterns, it's highly motivating. And paraphrasing Georgia Ede, our friend and colleague, is like psychiatrists, we are always have been known as the doctors that make people gain weight and sedate them. And these new interventions allow us to give them not only hope, but reality in regards to losing weight, feeling better, and start de-prescribing, which in psychiatry is a very, very hard thing to do.
I really wanted to include that message of hope from Ignacio because I don't want you to get discouraged by how many potential concerns we've reviewed in the past two videos. I can see how someone could say, wow, that's just too much to talk about with my doctor, too many concerns, why even bother? But remember, the most important points to talk to your doctor about are approaching your doctor for help as part of your team to monitor for safety for a timed experiment, and ensuring that you're going to stay on your medications, that you just need their help to do this safely. It's also important to have resources to share with your clinicians, which we'll include in the description of this video. But the point is the 8 points of potential concern covered in this video and in our previous video are potential concerns, right? Many doctors won't have any of those concerns and will be happy to work with you. But for those who do have some of these concerns, I think it's important that you're prepared ahead of time. Again, not to be confrontational, but not to suggest you know more, but to help point your clinician to resources that maybe can help them understand more and learn more and then be able to work with you better. You know, unfortunately, doctors aren't taught nutrition very well, especially low-carb or ketogenic nutritional intervention. And I hope we can all sort of start to change that. Now, you may have noticed that I emphasize point 8 as possibly being the most important. It's likely true that therapeutic ketosis won't become part of so-called mainstream care until we have supporting large-scale randomized controlled trials. So in the meantime, how do we balance this combination of lived experience, clinical experience, mechanistic studies, theories, observational studies, randomized? How do we combine all that? And how do we know who could benefit from therapeutic nutritional ketosis? Well, in this next video, I'll interview metabolic psychiatry experts and ask them this question to help you better understand who could potentially benefit. So as always, if you liked this video, if you thought it was helpful, please click the thumbs up and subscribe buttons, and make sure to share this video with your family, your friends, your healthcare provider, so you can help spread our message to help as many people as possible. And also please leave a comment. We'd love to interact with you and hear what you found most helpful from this video and from our other videos, or what you'd like to see in future videos. So thank you so much for watching. Please have a great day. Take care of yourself, take care of others, and we'll see you here next time at Metabolic Mind.